Hi everyone, welcome back to my channel. I'm Kimmi Madeline. In today's video I want to do an update after my touch-up surgery in my right eye after I did a laser surgery 3 years ago. There are quite many videos on my channel about my eye surgeries, so if you haven't checked them out, please do so before this update. If you're interested in learning more about my journey, it's been almost 4 years now since I did the initial eye surgery on both of my eyes. It was just a normal LASIK eye surgery. It's not actually called LASIK. Here in Sweden they have another version called NoCut, which is basically kind of like an improved LASIK surgery, that they don't cut anything in the eye, but the healing process should be a little bit longer than the one that they cut, the FS LASIK. To just do a quick look back at how it all began. So back in 2013 in December, I did the initial surgery on both of my eyes that was supposed to remove my myopia. My prescription was on the glasses -7, and on my contact lenses was -5.75. On both of my eyes it was pretty much the same, but on my left eye I had a little bit more of astigmatism, 0.25. I don't know if those numbers tell you anything, but if you want to compare, that's my situation prior to the surgery. And so back to my right eye. So after the surgery I was off from work for 3 weeks, and then I went back to work, and I noticed that my vision was really blurry on this whole side. So 3 weeks after surgery on my right eye, I went back to work, and I noticed that my eyesight was actually worse than prior to the surgery, this latest surgery, and I could not really see that well. Like, it was really straining to look in that sort of way because my left eye could see properly, but my right eye have this sort of blurriness that is really strange. It's like, oof. But it has improved since then. It's not as bad anymore, or maybe I have gotten used to it. So what happened was that I contacted my eye clinic and asked them why it's not improving. I need to have an appointment to check up my eyes. So basically that is why I haven't done an update video since then. It's been just a lot going on, and I haven't really thought about this because I've been trying to improve it. And I went back, and then they told me that I should have taken the eye drops for 3 months, the steroid eye drops, the cortisone ones. And the nurse who was there the day that I did the surgery, she told me to take them for 18 days, which was like shocking to me. Like, if I was supposed to take them for 18 days and no one reacted, I only took them for 18 days, and I didn't get a checkup for another, like, I think it was like 7 weeks. So I never even had a chance to address that. So when I had the checkup, I only met an optician. And the optician, she was new to the clinics. She didn't know my story. She didn't know anything. Basically, everyone at this clinic usually knows my story because I've been there for like three and a half years. So by that time, I asked her what kind of eye drops should I take. She told me, oh yeah, just hydrating ones, and just continue with what you're doing and just come back in another whatever weeks. So I reacted on this. Like, I think I noticed by myself that things are a little bit off and why I'm not taking the right eye drops. I asked them to send the medical journal to me, the copies of them, and I looked them through, and that included everything from the beginning when I did the surgery up until now. I noticed in the journal notes that I was supposed to take the eye drops for 3 months, and I called them and said I didn't receive enough eye drops to take them for 3 months, and secondly, I didn't get the information that I was supposed to take them for 3 months. So they checked it up. Two or 3 days later, they gave me a prescription. I took the eye drops, and I started taking them until my next appointment, which was at the end of August. So it's been a month since my checkup, almost. And the doctor said that it's a lot of haze in the eye. There have been some people asking about the progress during this time, and I just wanted to make sure to give you an honest update. And I am not happy with how this has gone. I think that... Okay. So I think that up until now, up until the last surgery, the latest surgery that I did, I had a lot of patience. I had a lot of hopes, and I had like faith in the doctors and that they knew what they were doing. I think that has changed since the last surgery. I think I am more regretful, but I'm not a person who usually regrets something I've done or looking back and thinking about those things. But if I would have known things about eye surgeries back then in 2013, I can tell you now that my conclusion after 3.5, almost 4 years is of issues and dealing with these problems. I can finally say, and this is my conclusion, that I would probably not recommend doing this kind of surgery if you have a similar situation to me prior to the surgery. I think everything had to do with my high prescription and my sensitivity towards these day and night contact lenses. I think the day and night contact lenses that I had already tried, and I told them that I have issues with them, they didn't even think about that would be a problem. I mean, seriously, it's about my eyes, and they should have listened. It's a lot of these things, and I think I can't speak about other eye clinics, so I think it might be something that my eye clinic does, but at least there should be other ways of dealing with if the patient have problems with something. In Sweden, they consider this a cosmetic surgery, which means that I don't have that many rights as a customer because I'm not a patient and it's not done in a hospital. So there are a lot of those things I've checked up, and there are no rights, and you cannot sue them or anything like that. You cannot... Yeah, so what else do I have to mention? The thing is, since I've had a lot of these thoughts during this time, I have decided to do more second opinions from other eye clinics. I will not only do them here in Sweden. I think it's difficult doing second opinions here in Sweden because other eye clinics don't want to take responsibility for something that another eye clinic has done. So I have decided to do more second opinions in India this time when I'm going there. In November, I will go to 3 different eye clinics in 3 different cities because I need some answers. I need to know if other eye doctors have the same opinion that you have to treat it with eye drops. And these eye drops are actually dangerous to take if you take them for a longer period of time. You can get like problem with the pressure in the eye pressure. They usually check it every time I'm there just to make sure that it's not been increased or something like that. If you have bad eye pressure in the eyes, you have a higher risk of getting this disease. I will put it here because I don't know the name in English right now. And that disease is usually something you can get in older age, but you can also get it if you treat your eye with these cortisone eye drops. Anyway, this video is getting too long. I'm babbling on. I wanted to do a brief update. This is what it is. I have another checkup in beginning of October, and we'll see what they say, if the haze has decreased or not. I will update you guys in October next time, so take care, and see you guys soon. Bye.